Hello everybody, my name is Carol Walker and this is Sophi Thunus. We come from UC Belgium. Today we're going to present our poster, which is about a social conception of policy change in the context of mental health care. So this poster draws on 3 research projects that were carried out in Belgium on the mental health care organization. The policy change was initiated in 2010 with the 107 reform. The aim of this reform is to shift from a hospital-based towards a community-based model of mental health care through the development of local and integrated care networks, which aim to get professionals from different services and sectors to work together and realize 5 care functions. So, what does policy change mean? Policy change in this context refers to a revised conception and organization of mental health care in which is processual and in which communication unfolds between different social systems continuously. In policy change, roles and relationships are constantly evolving between key stakeholders. So, a social conception of policy change involves communication between different social systems, and it contrasts with a traditional approach to policy analysis in which different phases are separated between conception, implementation, and evaluation, and also between different levels of action, which are international, national, and local.
So a social conception of policy change is based on 5 key elements, which are documents, projects, coordination, meetings, and practices. These elements are viewed as strategic aspects of the social life of mental health policies. In the framework of this presentation, I will give more details on 3 aspects, which are documents, coordination, and meetings. Regarding documents, the example of this presentation is a policy guide, the policy guide which defined the Reform 107, which is currently implemented in Belgium. The purpose of a document as a policy guide is to stabilize the initial meaning, the initial objective of policy change in the field of mental health. This stabilization of meaning occurs, among others, through references to other documents. An important aspect of document is that they are a material support which are able to circulate and to convey meanings through time and space. However, documents which are issued by the political system need then to be interpreted in different systems. Meetings. Meetings are precisely spaces required for the interpretation of documents. There are also social spaces where different social systems communicate with each other. In the framework of a meeting, each system communication is an occasion for another system to observe a difference relating to how mental health care is conceived and how mental health care should be organized. So different conception of mental health care and how mental health care should be organized are enacted or communicated through meetings. However, meetings are only transient interaction systems, meaning that they last no longer than the interaction, than the meeting itself. Accordingly, the important question, if you want to understand, according to this conception, if you want to understand which direction policy change is following, the important question is to understand how a particular conception of mental health care is finally selected, and how different pieces of knowledge and information are articulated together and stabilized. This is part of the work of coordinators. Network coordinators are a new type, or relatively new type of professionals responsible for steering the development of projects in the field of mental health, and responsible for organizing and sharing meetings, as well as reporting on meeting communication. The very specificity of this new kind of professional is to draw on informal sources of power. The most important source of power is their management of process. So what does it mean? It simply means that by dealing with process, for instance, through organizing and sharing meeting communication, then on reporting on meeting communication, coordinators are in a position to select which information or which type of conception of mental health services should be retained, and then to inscribe it in documents. So over a process of 5 to 10 years, coordinators are just selecting pieces of information, articulating them together, and giving sense to policy change. In conclusion, based on this social approach to policy change, can we hope to exert any control over policy implementation? It's very difficult to exert control on meeting communication, on the selection process, because it is very contingent on interaction and communication, but with these key elements of project management, coordination, and meeting management, we can find a way to improve the way we are dealing and trying to orient, to give a particular orientation to policy change in the field of mental health. Thank you for your attention.